What's going on, everybody? So, a lot of people struggle with their protocols. They struggle learning their paramedic drugs, their EMT basic drugs. And I've had people ask me, hey Mario, how do you memorize or how do you learn your drugs that you have to administer at Annabelle Fire Department? Well, it's very simple. I sit down and I test myself constantly. It's kind of boring, but at the same time, probably need to close this. It's a great way to assess my skills, be honest with myself, see what I know and what I don't know, and then go from there. A lot of times people want to just pay money and get like a shortcut, but whenever it comes to memorizing your skills and like properly applying them, there's no real shortcut. You just have to study, you have to practice. So let me close this. Anyway, some people will make the mistake where they'll think that they know medication, and they'll kind of glance over it and they'll have the answers out in front of them and they'll be like, acetaminophen, oh yeah, that's 1,000 milligrams, I know that, and then they'll move forward, right? Or they'll be like, adenosine, it's 6 to 12 milligrams, I know that, but they'll look at the answers at the same time. You don't want to do that. What you want to do instead, whenever you're trying to learn any protocols or anything, and this is for any students, anyone trying to take the national, have your answers out, cover it with your hand, and then test yourself and see if you actually know your protocols. You'd be surprised. A lot of people struggle on adult and pediatric doses, specifically pediatric doses, but they think they know it. They glance over the text on it and they're like, oh yeah, this is easy. But if they put pen to paper and actually properly test themselves, they'll realize that they don't know as much as they think they do. So I'm gonna go through a little test and I'm gonna use you guys to help me. So right here I have acetaminophen. I can't use you guys at all. That's not gonna work. I have acetaminophen. I have it blocked right here. And the adult dose for Annabelle Fire Department is 1,000 milligrams if they are greater than 70 kilograms. If they weigh between 50 to 70 kilograms, it's going to be 500 milligrams. If it's a pediatric patient, it's going to be 15 milligrams per kilogram. So let's take a look at the answer. It is exactly what I said, along with a lot of other text. So it's really important that you properly test yourself on these kind of things, especially if you're going to be taking a written test later on like I am. Next is adenosine, and my adult dose, it's covered right now so I can't see, is going to be 6 to 12 milligrams followed by a 10 to 20 ml flush, followed up with another 12 milligrams up to 30 milligrams of medication, and you do it every 3 to 5 minutes. For my pediatric dose, it's going to be 0.1 milligram per kilogram. I know that that's correct because if you think about it, if 30 kilograms for epi 1 to 1,000 is pretty much the max you're going to do, because after that it's an adult dose from a pediatric dose, is again it's 30 kilograms. Then if I do 0.01 milligrams per kilogram for adenosine for a pediatric patient, then it's going to end up being 0.3 milligrams at a max fully grown pediatric patient. That doesn't make sense. But 3 milligrams for adenosine in comparison, that makes more sense. So I can rationalize that 0.1 milligram per kilogram is my dose, and then you follow it up with 0.2 milligram per kilograms. So if you see here, we have our adult dose, and that's going to be blah, 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 exactly what I said. Pediatric, it's 0.1 milligram per kilogram, so makes a lot of sense. The next one is albuterol. It's going to be, we do 2 doses, so it's going to be 5 milligrams in a nebulizer, and we repeat it up to 3 times at a max dose of 50 milligrams. For a pediatric patient, it's going to be 2.5 milligrams up to 7.5 milligrams. That's correct? Oh, that's crazy. Aspirin, we're going to administer our adult medication at 324 milligrams. For a pediatric, it is not indicated. Yep, that's right. I guess you just have to take my word for it, right? When I had my doses, For atropine, it's going to be 1 milligram every 3 to 5 minutes, up to a max of 3 milligrams. For my pediatric patient, it's going to be 0.02 milligrams per kilogram. For a child, you want to max them at 0.5 milligrams per round, and it maxes out at 1 milligram for a child, 2 milligrams for a teenager. At the same time, for organophosphate poisoning, we want to administer 2 milligrams every 3 to 5 minutes until secretions dry up. So, very oddly specific, but if you look, I am generally correct. Calcium gluconate, 10%, that's going to be the medication, and it's going to be used at 1,000 milligrams or 1 gram over 2 minutes. Because you would consider using it over a code, it wouldn't make sense for 10 minutes because who's going to do a slow IV push for 10 minutes, right? So, pediatrics is not indicated. If I look, I'm correct. Pediatrics, calcium gluconate, the gel is for hydrofluoric acid burns, which I talked about greatly in my medical emergency video. And that's going to be administered topically as needed for adults and pediatric patients. For dextrose, I should show that I'm still covering it right. For dextrose or D10, here's my dextrose. And I have diphenhydramine also, I believe. Oh, it's diazepam, sorry. So for dextrose, it's going to be 25 grams. And for a pediatric patient, it's going to be 0.5 grams per kilograms and as needed. I guess take out the as needed part, because then why would I calculate a dose, right? Again, don't exceed an adult dose though. For diazepam, it's just double whatever Versed is, super easy. Diazepam or Valium, it's going to be 2 to 10 milligrams. We want to consider it as our first line for seizure medications if we can help it, but it can't be administered intramuscularly because it is a water-soluble medication, so it doesn't work intramuscularly. For the pediatric dose, it is 0.2 milligram per kilogram because it's double the Versed dose. Again, if we think about 30 kilograms, then it's going to be 6 milligrams. That falls in line with giving a pretty decent sized Valium. If I did 0.02 milligram per kilogram, it'd be 0.6 milligrams. It's not even 1 yet. For a fully grown kid, that doesn't make sense. So, oh, I also didn't mention the rectal dose, which I could have, which is 0.5 milligrams rectally per kilogram as needed, which is an insane amount of medication. I feel very uncomfortable doing that. Oh, I've already done this page. Diphenhydramine, it is going to be, you can see we're starting here. Diphenhydramine, it's going to be 25 milligrams or 50 milligrams for an adult. For a pediatric patient, it's going to be 0.75 milligrams per kilograms. And I already know it, right? Yeah. Epinephrine 1 to 1,000, it's going to be 0.3 milligrams intramuscularly. For a pediatric patient, it's going to be 0.01 milligram per kilogram. It's not on here on our medication list, but if a patient has an acute respiratory distress and we've gone through every single medication, we can finish off by doing epinephrine 1 to 10,000 at 0.5 to 1 milligrams. But it's not written on here, so I might have to talk to my EMS lieutenant about it. But you can see I should be right. That's 1 to 10,000. Oh, I said that dose. I did specify that as 1 to 10,000, but I shouldn't have said that. 1 to 10,000, I messed up with my wording there, is going to be 1 milligram. And for a pediatric patient, it's going to be 0.01 milligram per kilogram. Again, the whole thing about acute respiratory distress is reserved for the 1 to 10,000, not the 1 to 1,000. And that can be given IV. For fentanyl, it's going to be 50 to 100 micrograms, although the micrograms is written as a U-ish. They're synonymous, it's just the Greek interpretation. For a pediatric patient, it's going to be 1 milligram per kilogram, or microgram per kilogram. The pediatric dose for fentanyl is 1 microgram per kilogram. So, there you go. Sorry that this is a janky way of kind of proving it, but I want to make sure that I kind of show you how you actually should study your medications. You shouldn't just have the answers in front of you and then just say like, acetaminophen, yeah, it is 1,000 milligrams. That's easy. No, this is actually how you should learn it. And if you mess up, recognize that you mess up on it and go back to it. So next, we have furosemide or Lasix. That's going to be for a pulmonary edema patient. It's going to be at 40 milligrams unless they already take furosemide. Then we give them 80 milligrams and it maxes out at 100 milligrams. For a pediatric patient, it's going to be at 1 milligram per kilogram. So let's kind of make it visible. Oh, is that my doses? Oh, super weird dosing there. For glucagon, it's going to be at 1 milligram up to 3 milligrams. But if it's a calcium channel blocker or a beta blocker, then it needs to be between 3 to 5 milligrams. For a pediatric dose, it's going to be, for glucagon for a pediatric dose, ooh, I don't know. It's not coming to me clearly. Point 0.01 milligram per kilogram, I'm guessing. It's 0.5 milligrams, and it's not indicated for children less than 4 years old. You can see here I was right at least about the adult dose. For glucose, oral glucose is going to be 15 grams. And for the pediatric dose, it's going to be at 10 grams. And also for oral glucose, sorry, it's 15 to 30 grams. For pediatric dose, it's 10 grams. But I'm right. But I didn't mention not for children less than 1 year old. That makes sense, but if it's there, I need to mention it. So I kind of screwed up on that part. There you go. Sorry if all of this is horrible quality. For ketamine, it's both for adults and pediatrics. It's going to be 0.3 milligram per kilogram. For labetalol, it's going to be 10 to 20 milligrams. It's not indicated for children. That wouldn't make sense to give it to them anyway. For lidocaine, now this is a big dose. It's going to be, you can see how big lidocaine's written there, right? For the adult dose, it's going to be 1.5 milligram per kilogram, followed up, if you need to, by 0.75 milligram per kilogram, then 0.75 milligram per kilogram, adding up to 3 milligrams per kilogram. And then we have a lidocaine bolus, which is going to be between 1 to 4 milligrams, using the clock, where 1 milligram is 15 drops, all the way up to 4 milligrams, which is 60 drops. For a pediatric patient, we go to 1 milligram per kilogram, and then right afterwards, we go straight to a lidocaine bolus, between 1 to 4 milligrams per minute. Oh my gosh. I screwed up. I took a glance. I saw the 40 already. No good. For lidocaine, it's 1 milligram per kilogram, and then you do our lidocaine bolus at 40 milligrams or 40 micrograms per minute. So if I have a 10 kilogram pound patient, it's 40 micrograms. We know that 1 milligram is 15 drops. So we take 0.4 milligrams times 15 drops, and that's going to give you 6 drops. So I would have to set it at 6 drops per minute to give 400 micrograms or 0.4 milligrams a minute. For magnesium sulfate, I messed up on that. I need to revisit that. For magnesium sulfate, I'm going to administer 2 grams or milligrams? 2 grams of mag sulfate for preeclampsia, 4 grams for eclampsia. For torsades de pointes, for us, we administer 2 grams. For pediatric, it's not indicated, but why would you ever consider it, right? We're talking about pregnant patients and weird ventricular arrhythmias, such as torsades de pointes, so that would make sense. It is 2 grams. We also have to dilute it. So ours comes in at 50% concentration, so in 5 milligrams or 5 grams per 10 mLs. So if we go from a 50% concentration to a 10% concentration, we have to take that, draw it up into a 50 cc syringe. First, we drop the 40 cc's of saline, then we drop the 10 cc's of the medication. We mix it around, and every 10 milliliters or 10 cc's is going to be 1 gram, essentially. So we'll never use all 5, but it's the best way to mix it. You could do the math for like 32 milliliters of saline and then 8 milliliters of mag sulfate. But then you're confusing things too much, and while I might feel comfortable doing that, I don't know if my coworkers would feel comfortable doing that, so I don't teach them that way. It'll just end up making more mistakes. methanol or methylprednisolone or solumedrol. It's going to be 125 micrograms or milligrams. I think it's my milligrams per minute. Or for a pediatric patient, it's going to be 2 milligrams per kilogram. Let's see. It is milligrams. Nice. You guys are going to see everything upside down, so I'm sure no one will appreciate that. For midazolam or Versed, my adult dose is going to be between 2 to 5 milligrams, and it maxes out at 10 milligrams, but it doesn't say it on here. It says it more so in the actual protocol. For a pediatric patient, it's going to be 0.1 milligram per kilogram, but special note, for an adult patient for the adult dose, it's going to be 1 to 5 milligrams if it's IV or IO. It's going to be 2 to 5 milligrams if it is intramuscular or intranasal. So it'll say that. Oh yeah, we killed it. Morphine sulfate. For morphine sulfate, the adult dose is 2 milligrams to 10 milligrams for an adult. For a pediatric patient, it's 0.1 milligram per kilogram. It's just easy. Narcan or naloxone is 2 to 6 milligrams. For a pediatric patient, I think it's 0.5 to 1 milligrams to a max of 2 milligrams for pediatric. We're cooking. Nitroglycerin, we like the little wins. Nitroglycerin is going to be 0.4 milligrams or 400 micrograms, depending on how you like to word it, up to a max of 1.2 milligrams or 1,200 micrograms, which is just up to 1 spray every 3 to 5 minutes, up to 3 sprays max, sublingually or under the tongue. And then pediatric, it's not indicated. That wouldn't make sense to give it to them. And then I'm correct. This is how you need to learn your medications. You need to be honest with yourself and accept that you're not going to get all of them right, but don't just cheat yourself and be like, oh yeah, I think I know what I'm talking about. And then you fail the national registry and you're like, oh, what happened? This is probably what happened. You probably didn't study properly. Anyway, norepinephrine or Levophed, that's a tricky one. It's going to be 8 to 12 micrograms per minute, and you do the clock, so it's going to be 30 to 45 drops, because our clock goes 4 micrograms, 8 micrograms, 12 micrograms, 16 micrograms, or 15, 30, 45, 60. So we're in the 30 to 45 range. For a pediatric patient, it's not indicated. That wouldn't make sense. Easy money. Next one is normal saline, as indicated, PRN, PRN. Yeah. Zofran or ondansetron is 4 milligrams for a adult and 2 milligrams for a child. I'm not even showing you that I got it right. Just trust me, I got it right. Our new medication, Afrin or oxymetazoline, is going to be 2 sprays in each nostril. Watch out for the contraindication of a diastolic blood pressure greater than 110. What kind of... I didn't say it, so it doesn't count. It's not indicated for pediatrics. I need to review that. But that's good to know. For sodium bicarbonate, it's going to be, this is a tough one. This is a very tough one. It's going to be 1 ampule or 50 milliequivalents. For a pediatric patient, it's going to be 1 milliequivalent per kilogram, but we carry it at an 8.4%. So we need to dilute it if they're less than 1 year old. I think it's 1 year old, less than 1, to 4.2%, but it's still 1 milliequivalent per kilogram. But basically we have to give them like as much sodium bicarb as we give that in saline also. So we'll have to use a 60 cc syringe, drop 30 of the sodium bicarb since it's 1 milliequivalent per milliliter. So if I wanted to give, let's say 10 megs, because I did 1 milliequivalent per kilogram, it's a 10 kilogram patient, so it's going to be 10 milliequivalents. I draw up 10 mLs from even a 20 cc syringe. First I would do the saline so I don't mix it. So drop 10 cc's of saline, 10 cc's of the sodium bicarb, mix it a little bit. That'll become a 4.2% concentration because you're just cutting it in half from an 8.4%, and then administer that. Nice. Also dilute if you're administering in the IO, so it's something I need to remember. And the last one is TXA, and that's going to be 1 gram over 10 minutes. It's not indicated for pediatrics. Yes, it's just a bigger word of saying that. That's all my medications in my protocol book. Was this a boring way to learn it? Yes. Was this fast? Yes, but that's because I studied a lot. If you're trying or struggling learning your doses, don't cheat yourself. Don't bother with like having like a PowerPoint or whatever, or a sheet, and then looking at the answers while you're learning it. You're wasting your time. You just need to cover it and just work on it. And if you mess up, go back, say, okay, I need to relearn this medication, go over it again, and then test yourself again, and then test yourself again. There's no easy way to do it, but as you do it over time, it's easy. Like, oh, I finished this in like 20 minutes or so. It's all my medications at Annaville, and I'm done. But I hope this can kind of point you guys towards the right direction if you are struggling with your protocols. There were a couple of things that I need to work on, especially on my pediatric doses, although I never administer a pediatric medication without consulting this anyway. There are good comments on there. But I hope you enjoyed this. I hope that if you're struggling with your medications, that this may be something you want to consider. And I will see you on the next one. Bye.